Okay, a few more people coming on. All right. Well, good morning again. I'm Mary Baskett. I think most of you know me. I'm the facilitator for the CCSIT, and we are so glad to have you all this morning. And we're going to jump right into our agenda. We're going to start with some updates and some points about upcoming meetings. Then the bulk of our time today is going to be spent talking about a concept called the GO team. This is an idea that came out of our Starting and Maximizing Childcare Businesses work group. And a lot of work has been done on it. And Melissa is going to be sharing what that work has looked like, and then mostly wanting to hear from you. So we have a number of discussion questions to pose, and we're going to do that as a full group today and not go into our work groups. So if you're in a work group, I'm particularly thinking of the regulatory group. There are a couple of little things that we wanted to follow up on, and we're going to do that via email after the meeting, but we will not be actually breaking into our work groups today. So with that, some updates. As many of you know, we are about to enter the third year of the PDG grant. That's the big federal grant that supports this has been supporting this work. So as with a number of other parts of the governance structure, and the CIT is definitely part of the governance structure, we've been looking at what that's going to look like going forward. So we've been evaluating the CIT and our membership process. And in the past, the CIT has been more of an ad hoc kind of group. Call together for particular purposes. And that certainly happened when we started the PDG grant a couple of years ago. But now we're seeing the CIT as an ongoing group, an ongoing team. And so following our meeting next month, members are going to be asked to serve a 2-year commitment. So for the coming 2 years to remain on the CIT. So that is a change, and we wanted to share that with you and certainly give you time to think about it. I can't stress enough how important this group is to the early childhood system in Kansas in general, and all of the great work that has been done by the CIT. And I think what this is doing is recognizing how important and beneficial all of you are to the work and wanting to keep that going. So obviously you'll have an opportunity to think about what you want to do in the future. We're going to talk more about how to stay involved at the May meeting, and also talk about how prospective members can apply to be members. We're continuing to work to identify underrepresented populations, those groups that we really want to bring in to ensure the most diversity that we can, to have the right balance of people from across the early childhood system, all components of it, as well as across the state. So that's a significant shift we're talking about. I think it's really exciting, and we hope you think so too. And again, we'll talk more about that during the May meeting. So as we are transitioning to a different kind of team than we have had, we just want to put out some expectations, again, so you can be thinking about your role going forward. I think these are all things that you've seen before, but we just want to bring them up again to you. We really want you to be able to commit to actively attending and participating in monthly meetings, showing respect and courtesy, sharing connections and updates from your organization or your role in the system. And then certainly sharing your questions, concerns, and requests related to child care licensing to continue to ensure that the information we're working with is timely and accurate. And then in terms of upcoming meetings, again, a little good news, we think. We hope you will think so too. We want to celebrate your hard work. We have been meeting since September of 2020. So we are getting close to a 2-year mark. And after quite a bit of discussion about where we are in the process and all the progress that's been made to date, we're going to take the summer off. So as you have put those dates on your calendars for June, July, and August, we will not be meeting during those 3 months. We will meet again in May, and then we'll resume our meetings in September. We will continue what we started with every third meeting being held in the evening. So that will begin in September. Our first meeting under this new structure will be an evening meeting. And we're proposing that we make a slight shift in time based on some feedback we were meeting from 7 to 8:30 in the evening. We'd like to back that up to 6:30 to 8, just to get everybody out a little earlier. So wanted to let you know about that. We are going to be sending out, and Clayton will be doing that, new calendar invites then for the remaining 2022 meetings. So those will be coming out. So again, the May meeting will be held as planned, but you can go ahead and take June, July, and August off your calendars and watch for that announcement about meeting dates starting in September. And then we will be resuming monthly meetings, so September, October, November, December. Are there any questions about any of that? Anybody have any questions or comments? Okay, I am not seeing any, but certainly feel free to put any questions or comments you'd like in the chat. All right. And here are the dates. Just go ahead and put those up. All right. With that, we are going to turn it over to Melissa to talk about the Go team. And anything else, Melissa, you'd like to share with the group?
I believe we might be missing a slide because there was also a slide, Megan, that might be missed about the new initiative with KDHE and our regulation survey that's available now on our website.
I think that is an error on my end. I apologize. Do you want to stop screen sharing to talk through that, or?
That would be great if you don't mind. And then we'll get that back to you when we're done. Just a few things that we wanted to share on just a KDHE updates slide. So hopefully I won't miss anything, but we'll definitely get it to the notes. The first one is just to welcome everybody on behalf of KDHE and Child Care Licensing. So lovely. It was fun to scroll through and see everybody's faces and get to connect with everybody again. But two KDHE updates. A recent policy exception was sent statewide. Actually, we had two of them this spring. Late winter, early spring, speaking to staff qualifications. They actually arose out of CIT, and so it's just timely to discuss them. The first one was discussing staff qualifications. KDHE currently already accepted qualifications if you worked at a preschool. That was through a school district. It did not have to be a licensed entity, such as what our regulations speak to. We expanded that a little bit to include anybody who had experience on a military institute that is licensed by the Department of Defense. So we're just kind of expanding what that looked like. We did receive a lot of questions regarding, well, does this mean if I'm a substitute teacher and I have my license that you'll accept all of that? No, we were very specific of where we would accept experience from. And again, that was through preschools that are ran through the school district, Head Starts that are licensed through the feds, and military institutes that you get in experience that are through the Department of Defense. So doesn't mean that we gave a blanket any type of experience. We were very specific in that exception. So I filled a lot of phone calls over the last 2 weeks since it's launched, and took a few at the end of the week before I took some time off. So very much in my mindset. We also provided some relief for program directors if they needed other duties and say their cook didn't show up today. Our regulations speak to that you don't serve in that capacity, but the exception does allow for that. What I did want to share with the group is that especially through the regulatory group, that these exceptions were really vetted through KDHE. And does this make sense? We don't use our policy exceptions that we provide across the state as a Band-Aid. We really want it to make sense. And does this help the regulated community? There have been a few ideas floated through the regulatory group, such as supervision and safe sleep. So it was really great to have Christy Shun with the SIDS Network at our last meeting to really, put it in the forefront, making sure that when we do look at any future policy exceptions, that we really do a deep dive into, does this make sense with the science? That we're not just doing something just to put a Band-Aid. So any of those other ideas will definitely be floated up as through a normal regulation review and part of when we look at our safe sleep. So we won't be just putting Band-Aids on anything that might jeopardize the care of children. And that leads me right into our next component at KDHE. Really excited to announce that we have a new initiative for the regulated community. In the Bureau of Family Health, we do regulate more than just child care licensing. So we have an opportunity for anybody in the regulated community to give their voice, to be able to hear if they feel like a regulation is a barrier. And so on our website, right on KDHE's child care licensing website, we have a new survey. We ask if anybody, and we have providers already using this survey to be able to drop in what the regulation they would like to see changed and why. But what I'm really proud of our work at KDHE, we're just not letting you just say, hey, I don't like this regulation. It's really, what is the barrier and what would you propose to fix it? And who does it put at risk if we change it? So it's a really thoughtful examination of the regulation. It's not just, I don't like it because it's causing me an issue today. It's really making anybody who engages in that survey to really put some good information. We've shared it with our surveyors. We've pushed it out to our facilities. So I will make sure that when you get the meeting notes that you have that link also, so that we want anybody who has any sort of relationship with licensing to be able to use that link. So those are just it for the KDHE updates. Megan, if you want to go back to, and I see Reva, so she gets to be our first slide as the Go team. So it was very timely, Reva, last week. Okay, so the Go team originated as sort of a concept within the CCSIT team. And then I've been working with some of our partners to really flesh it out. And it's to a point where we just really need to ask you guys some questions. But really, why would we even be discussing this concept anyway? So when we look at the state of childcare in Kansas, there was a wonderful article last week finding that was pushed out by NPR that finding childcare in Kansas was a challenge before the pandemic, and now it's even harder. So really, I read this and really gravitated to what Reva had to say, and really appreciated your comments, Reva. We used to talk about a childcare shortage, and now we're talking about a childcare crisis. But there isn't one simple fix. The solution is going to look very different in different communities. The more we come together and work collaboratively and collectively to try to address the need, the better off we will be as a society. I couldn't have said it better, Reva. I was like, this is really the concept of what the CCSIT team is. We're all coming together. So if, when I was scrolling through and looking at every agency that is representative, we have folks from far rural, frontier counties to urban. So everybody's crisis is just a little bit different. And how is there truly a crisis? What are we using as data to define what's going on within each and every community? So we're going to get into a little bit more deep dive to that. Megan, if you want to advance the slide. Okay, so the outcome for today's discussion, so keep this in the back of your mind, hopefully is we're going to define the Go team and what its purpose is going to be. Identify why now is the time, and then the linkages to CCL, because you represent a group that works directly through licensing. The CCSIT team really impacts our work. And then if it doesn't, how do we link into other early childhood partners? And then we're going to determine how to strategically incorporate and utilize the Go team concept to collectively accomplish shared goals. So we're going to ask you guys some pointed questions as we move through the slides. We're going to really assess community readiness and existing opportunities. And then again, we're going to have a Q&A forum, and then we're going to identify next steps. Okay, so as we really flesh through this, as it came out of the maximizing, what is a response team? What does that look like? The purpose and the goal of the Go team concept is to really provide collaborative team, multi-system approaches. I actively participate in a task force in Alice County, and it's a child care and task force. And the mission and who we have sitting at the table evolves monthly. And it's really driven by the community, and it should be really driven by data and what that looks like. And it encompasses non-traditional partners. Really, when you're thinking about who needs to come to the table, the first concept should not always be licensing, because it may not even be a licensing problem. It may be more a community initiative within your just a matter of the communication and understanding. An identified goal last week in Alice County specifically was all the preschools end at 10:30. And then, we don't have that regulation that allows for an 11 to a 1 to allow for the 2 extra preschool children. And so it's causing a lot of havoc within the homes. And it's, licensing doesn't necessarily even have to come to the table, but maybe it's a communication issue between the preschool providers and the home providers that they didn't even know. And nobody's talking. And so it's a really easy fix, and it does not necessarily mean that we have to build tons of capacity. It's more of a communication and understanding how all of the regulations play together and how we can work as partners. So it's really looking outside the box of the capacity doesn't always have to be the driving force of how we work towards addressing early childhood issues in a community. And then the approach could be a guided assessment planning driven by local leaders. You know, the task force in Ellis County is driven by the chamber. So it's not necessarily early childhood. It's really approaching this as a business approach. And then our partners, a broad cross-sector group, families and consumers, traditional versus non-traditional, just sharing that. And then really looking at, again, some of the issues with those partners, because it may not even be licensing. I know on the CIT team today, I have representatives from Manhattan and Wichita, and they have local codes that impact how you build capacity in your community that, you know, really are barriers that have nothing to do with licensing. So really looking at what is the issue and who's at the table and how do we move that forward. Coverage. Is this a statewide access issue? And how do we take that whole, it's easy to always say it's a crisis without defining that and quantifying it. And really then quantifying it at a community level, because every community is going to be drastically different. And then a foundational approach, looking at communication, collaboration with local leaders and families in the field, and getting past that talking. I've been in grassroots communication building since the onset of my career. And the most frustrating part is being in a grassroots is just talking a problem to death without actually moving it to a solution. And I think we're all guilty of that. And then how do you even find those low holding fruit wins that still feel really good for the community so you can move to that next level. So really that Go Team concept is moving to that next level. And springboarding off of our communities and actions groups. And so we'll chat about that a little bit more. Because Sarah, you just popped up within my on my screen, so it made me think about communities of action and how we get to that next level. And who does this align with, and what does it connect with? Aligns with All In for Kansas, the state plan. And it's a driver of a comprehensive approach, because right now we do have the accelerator program in Kansas. We have workforce development, and then we have our grants. And then we have, it connects through the local, everybody who's represented on this CIT team today, local surveyors, childcare health consultants, R&R. So, and I realize we have local surveyors twice and licensing surveyors. So I apologize for that error in our slide. And then, and it provides a next step for ready communities. I know most of you have, might be aware of it, but some of you aren't, that communities in action, we have 14 participating counties within our Child Care Aware network who came together and wrote I want to say a business plan, but it was really a springboard action plan of these are some initial goals. But then now what do we do? How do we move those communities forward? And the Go Team concept would be a perfect action plan for that next step for those counties. And I'm not even counting, there's like 5 other Northwest counties that were not funded through Child Care Aware. So we probably have close to 20 counties that are ready to move forward, that we are aware of, that we have specifically touched. That are ready to move forward on this concept. And I love this illustration here. We can either be organized or not. Sometimes we let the problem just dictate what we're going to do, and it overconsumes us. But if we all work together collectively, then we can tackle the problem. And Marcy, I saw your question pop up. Are those Northwest counties in the Dane-Jean-Hansen area? Yes, they were through, and Sarah and Kelly, correct me if I'm wrong, they were through the Live Well organization, actually, paid for those communities to come together and actively have a conversation. And they really came together. They came together during a snowstorm. And there was a lot of work on that day. And the snowstorm really is a mantra of the communities that work together, because we're all ready to put our boots on and strap in, and they did on a day that most people couldn't even drive, but they all connected via Zoom and they all did a great job. So anxious to see what comes out of that and how we move forward in that communities in action. Megan, you want to move forward? Okay, so what communities might be ready to partner? The Go team, I like to think about it as like an ambulance sort of coming in. They're going to triage. They're going to look at what can we do to move the communities in the next step. How do we keep them talking and moving to action? If we don't have these conversations, and we don't have conversations that might be uncomfortable, then we're never going to move into really good policy work and really good community action. We don't want people to feel like they can't share freely. We don't want people to feel that they are wondering, like, why didn't I get invited to the table? We want to have that conversation, because no set agency should own the work of a community. They should own their own work. So we want to make sure that we have everybody at the table to have those good conversations and those uncomfortable conversations. And really to assess what else is needed or wanted. We might not even, we represent a lot of agencies, and we might not even know what a community is doing at a grassroots level. Like in a community could be 3 people working, and they're really working hard to address. So we really want to make sure that we're honoring the work at the local level and mobilizing. So what we really have next for you guys is some strategic questions, because really it's sort of theoretical when we think about the Go team, but we really want to flesh it out so that when we are approached and we're going to be approached real timely, because a lot of these communities are moving forward, and they're moving forward in a really rapid way. But is it in a productive way? So the Go team concept would hopefully ensure that they are moving forward in a productive way in any type of manner. So what we're going to ask for you is some really positive questions. Some of them are challenging. Some of them are going to look very different for the community that you're working with and the agency that you're representing. But just feel free to come off mute, answer our questions, and we'll go from there. So the first one is, let's go back to Reva's initial comment about the crisis, pre-pandemic and post-pandemic, and just where Kansas is right now. And what does recovery look like for the childcare landscape, and how does the Go team fit in and support it? Any comments or any thoughts of what you represent and where your community's at? I'm known for just asking questions of people point blankly, and I know Brett Schmidt is on here, and he's an active member of the Alice County task force. So Brett, how could the Go team concept move the Alice County? Because I have an idea in mind, but I want to hear from you as a member. How could that move the Alice County task force forward? Oh, Brett, you're on mute.
I guess, sorry about that. I said something really profound. You guys missed it, so I forgot what it was now. I think just having the support of just the knowledge, I guess, of the Go team to get get a center or get a program underway. It's big. I said I would never do it again. I did it again. I have 2 that we've started, and I said I would never do it again. And stay tuned. But that Go team, I think, it's going to be critical because it is such a big task, especially seeing everything, all of the negative publicity in childcare of things closing down. That support is going to be huge for any community considering moving forward.
So just the structure of the concept of the Go team would be beneficial?
Well, I would say the structure, but I think the support of the Go team moving forward, because there's a lot of people that won't understand, obviously, in the community also, and having the expertise of the Go team to come in and help get it started, I think would be invaluable.
Okay, thank you, Brett. And Tanya and Adrian, you on my screen actually happen to be right next to each other. And I know you guys just did a Communities in Action in Wichita. So how could the Go team move you guys forward into the next level? Because you're very drastically different. Wichita does not have the same needs as Hayes does. So Tanya, I saw you come off mute real quick. I'll let you start.
I came off mute because I already saw Adrian shake her head. She was. So we are different, and with our Communities in Action, we've come together a little bit differently because we're focusing on the workforce and the economy and childcare and what it's doing in our local area. And it kind of comes full circle with the way it's affecting our entire community, and the lack of affordable quality childcare in our area is not helping people get into the workforce, and then in turn our workforce is not there and not able to pay for our childcare. So we're partnered with some pretty big leaders in the community, and we actually just had already our follow-up meeting last week to move forward. And I was actually thinking this could be helpful because what we're trying to do is we're not stopping. We're trying to get those leaders in the community who actively engage with employers and help them understand what support is out there so that they can work with their employees who happen to be or want to become families and have children, and maybe partner even with childcare providers in the field. We know that, like Brett, building a facility is going to be difficult. So we're trying to figure out what is already out there, even down to the tax credit that's available and what employers can do to get on board with supporting their employees. So that's kind of where our focus is.
Okay, yeah, that is a different, it is a different narrative. So again, it shows you every community is different, and then just helping educate, because Adrian, I mean, you did a great job just educating on your local code, and then how does that move forward? Any additional comments to this first question before we move to the next one? So I think I'm going to tailgate on what Tanya just said. Is the next question is, what does success around Go Team look like? So if you partnered in moving forward this concept within your communities, what does that success, how would you define success for you guys as a group?
For me, one way to look at success is just that the community would feel supported by the larger childcare world. And that's a beginning step for success, just to they might not know who to specifically ask in to answer a question. So the Go team is more broad in scope, and I think it means everything to feel like you're supported and not ignored. So I don't want to diminish that comment.
I really appreciate that, Marcy, because for a very sort of nebulous concept still, as we're fleshing it out, that I think that in the back of my mind has always been the most important is how do we support communities? How do they feel heard? Because sometimes it's not about getting 20 new daycare spot. It's just the process needs to be heard. Everybody needs to be at the table with an equal, and sometimes our home providers don't always feel that same bond with everybody else having, these big centers and all of that. So I appreciate that. Or even rural communities feel a little bit different. Kristen, I saw you come off mute.
I think on a surveyor standpoint side of it, it feels like success because we feel supported. So when the community comes to us and is like, hey, we want to start this survey, or we want to start a center, and we give them all of this information, and then they kind of feel frustrated by the overload. But if we had a support system to give them and say, here, all of these people want to help you be successful, that helps support us along the way also.
Yeah, you're the conveyor of information, and not just information, not just saying here's the reg book, because you have other duties you do. You can't always hold their hand 50 hours out of the week. But then this provides them a support system to help discuss, how do I set up a staffing plan? How do I get tax breaks? How do I do these other components? That's an interesting concept, Kristen, that totally was not on my list. So I appreciate that. Thank you. Mm-hmm. Does anybody have any other comments before we move to question 3?
Melissa, I want to piggytail off of what Kristen said. I've worked with a couple of different groups, and if you could give them just a list of contacts of who they can go once they leave the table, who they can ask questions, so that they have that point of contact, that if they don't know the answer, who can they go to? And just to have that friendly voice that they can say, because our childcare world it's our own living organism that a lot of I'm going to just say our school districts don't understand, our cities don't understand. Childcare is very unique, and the education process is just overwhelming to them. But to have that list of contacts that they can say, reach out and go, I really don't even understand what training, who to go to, so that they have those resources once they leave the table, because they're going to have those questions once they leave, that they feel comfortable coming back and asking questions, and just to have that point of contact when they get lost, so that somebody can help them find their way, would be helpful.
I appreciate that, Lynette. That's a really good comment. And to piggyback on that, we're going to go right into number 3. If we were to engage your communities, the Go Team concept, what would you want in place? What must be in place to support success, looking at governance, tools, resources. So Lynette just touched upon a resource. Like, do we have a list of these are the people you need to contact? I even think it would be amazing to have in the state of Kansas a list of architects who are just specific to childcare, to who are used to understanding the state fire marshal code, and who also understand this is a concept for little people, and this is what it looks like. We don't even have really a good list of that in the state. So that when I'm thinking about all of the things that the Go Team could be, that's one of them, and having some support. So totally piggyback on what Lynette's comment was. Is there any more that you guys would like to see as what must be in place to support success?
Melissa, before we go to that, Nicole had her hand up, so I wanted to make sure she had a chance to share.
Yeah, Nicole.
When you were asking how are we going to measure success, it was very simply, are we seeing people use it?
Right. Thank you.
Thanks, thanks for making sure I was heard, but it was very, very simple.
I like it. Thank you. Okay, so if you're using it, what does those supports look like? So going right into question number 3. So any other comments? Heather, I see you came off mute.
Well, I think just making sure that everybody is at the table. I know that as far as licensing, we weren't aware of our community and actions meeting for 3 of our counties. And so we missed out on knowing that about that. So I think really just making sure that everybody is, there and at the table to make those decisions and help everyone along the way. And we do have some of those resources here. We do have a list that we give out that has like our who to go to for codes, who to go for our local fire. We give them childcare wear and casito and all that information. But I know there's, plenty that we could add onto that resource list too. So I think that's a really good idea.
And I appreciate your comment about having everybody at the table initially. We may not always have to, you get to fly in and fly out based on the needs, but actually having everybody engaged at the very beginning, even those non-traditional partners, is very important. So thank you for sharing that. Any other comments before we move to question number 4?
Melissa, I wonder about sharing examples of other communities that have done X. If a town of 800 wants to do something, they might feel like they can do it if they go to see another town under 1,000 that has done something.
So not reinventing the wheel, having connections is just the Go Team concept is critical to connections, so that communities can see success, and then they can also learn from each other's, because it's okay to fail. I mean, I think we don't allow ourselves to fail, and I really appreciate Paula as the new director in childcare licensing. And that's been one of the things, that it's okay if we fail. And we learn from that and we figure it out and how we move that. And we don't share that enough. We always want to share the successes, but we also should share things that we've done that have failed. So no one goes necessarily, or maybe figures out a different way to approach the project. So I like that idea of community models.
I mean, sorry, I'm speaking up again, but I do think in our community, we've had people that have wanted to look at another center. And I think it's been nice because our centers have been really welcoming in that. And so letting someone else come in and look at their center and see how it's set up. And so you can kind of, in your mind, kind of decide what you think works for them or what would work for you and maybe what you would do different. So I think that having that like community spirit, and it's not competitive, we're trying to help each other out. So I think that's really important.
Yes, like that networking piece of it, to be able to come together. I know just as a surveyor, we're grateful for other surveyors to just bounce ideas off of, like, hey, what do you do for this? Or what do you do for that? So I think that networking piece would be great for the community and providers together.
So when you're talking about the community, both Heather and Kristen, this leads me right into question number 4. What other partners do we need to engage in planning? Because obviously all of you come to CCSIT because you care about early childhood. We wouldn't be here. Everybody is engaged at some level of early childhood. Who are we missing? I mean, when you're really wanting to get down to the nitty gritty and the movers and the shakers and then and those in our communities, who do we miss to bring into the table?
I think that, Melissa, what we're seeing in some communities, and I know we're seeing it in Manhattan, is like local chambers and local business groups becoming more involved, which, is an ongoing experience in educating in both directions, and so the more we can kind of bring the business community to the table, I think the better for all of us.
I really love that idea because I am now on a very first name basis with our local chamber, and I would have never engaged that. And I have been in the early childhood business in Alice County for years and just never saw that partner. And if we're really wanting to elevate the workforce and being looked at as a profession, having that chamber, Brett really worked hard with the chamber to get them to recognize all of our daycares as a business, as a local business within our group. So appreciate the local chambers because that they have really popped up over this last year because it's about getting in new businesses. And Bernie and Heather, I'll be curious how the child care crisis is framed moving forward in Manhattan, and with a new announcement yesterday of the new infrastructure and business built there, and how you guys come to the table to address that, because that's going to be next. If you build it and you bring in new employees, do we have childcare for in Manhattan?
That's the first thing I said is I don't know where their kids are going to go, because we already have this NBAF that's supposed to be bringing people in, and we don't have anywhere for their kids. So.
Yep, I texted Heather the minute I saw that list come out. So I was like, oh, that's going to be next thing that's going to come hot and heavy on the news. Kelly, I like your families. You're right. You can't do this without family investment and in appreciating in the provider. And then Riva, I saw your hand up, and then I think Nicole had a comment too.
Yeah, I just find this conversation really thought-provoking. And I just wanted to say we hosted 3 communities in action sessions in our region, and they were all very different. Mm-hmm. And it was really important to us to let the organizer kind of set the stage. So, I don't want anybody to feel like they were purposely excluded. But for example, here in Topeka, our chamber drove that process. They planned the agenda, they decided who needed to be there, and they wanted to start this conversation with employers. So we did have a few childcare providers there, but they really wanted to talk about this from an employer's perspective first. And then stage 2 will be forming a task force and making sure that we have representation from licensing and from all of the direct service providers. So I just thought it was important to think about, and what keeps coming to mind is the Kansas Leadership Center principle of giving the work back. I don't think we want to tell a local community what they should do. I think we need to let them take leadership and be there as that support, because otherwise they're just going to say, go forth and fix our childcare program and our problem. And I don't think any of us can do that alone. So I'm really excited for this conversation and for thinking about ways that we engage and join the work that's already happening at community levels and provide support, and that maybe expertise at times, but also not feeling like we have to drive the bus.
No, and that's one of the things, Reba, I'm using the word appreciate a lot today because I do appreciate this conversation. We can't, licensing is very limited in our own staffing too and resources. And so it's, when does that expertise need to be there before, I think the whole concept of the idea of the GO team is to then meet the community where they're at, not be the driver, but also help ensure that the community doesn't get down a path that then licensing has to come back or say, sorry, we can't do that. And then that doesn't feel good for anybody. So it's just figuring out where they have to be and plugging in the holes, because the workforce, like example of Wichita, licensing can't do anything about that. We can't physically duplicate bodies. They don't exist. We can't be that, but we can look at what regulations might be a barrier as we're moving forward in looking at lead staff and anything along those lines. So how do they complement each other? So I really thankful for you sharing that. And then Marcy, your hand is up.
I don't know really how to start this, but I'm thinking about fire marshals. I know that's an issue. If someone was on the Go team and they heard how the fire marshal delays were part of the issue, if they heard and saw the people, would that motivate them to do something? I have no idea what the issues are behind the delays, but that seems to be one of the issues, timing, getting the fire marshal there. I really don't know what I'm saying about that, but I always wonder, how can we motivate them to, and I don't know if it's them, but how could that issue be looked at and helped? Is that even a reasonable, I defer to all of you, whether or not that's, is there anything that can be done?
I think that goes back to just their workforce too, with the fire marshal. And Paula, I know you met, so I'm gonna let you tag team that conversation.
Yeah, when it comes to the fire marshal, they have, when I was working at KDADS and since moving here, they are still, they have finally kind of hired people to do the surveys, but now they are in a training process, which is similar to the surveyor training process here, where they can't be out on their own right away. They have to shadow someone, things like that. And that takes 6 months to a year. So I believe they're finally getting their workforce up to a place where they can, try to catch up. So just some background on the Kansas fire marshal delays and why that's happening. And it was an issue before the pandemic, but the pandemic just threw it into a tailspin. And now they're finally coming back. I want to say, Brenda McNorton told me that, I want to say 2 months ago, shortly after I started. So.
Thank you for piggybacking on that. So, Marcia, I think to go back to your question, maybe it's not necessarily about getting them through the final process, but having some information or somebody on the front end that can help a community understand, is this building a viable option by the fire? And if it is, what would it cost? What does it look like? Maybe some more of that technical assistance expertise, because I think licensing knows just enough to be dangerous with some pieces of the fire, and but we definitely don't know enough. I mean, I know I need a second exit out of that room, but I go back to some of those facilities that think they can retrofit a community or building, and then they get that sticker shock of, oh, this is going to cost $20,000. So maybe having some of that consultation at the front end, that could be something of the Go team. I think more so than the final piece, because that's just day-to-day work, hopefully at the end piece. But would be nice to let communities know early on if it was viable. Would that be helpful? I'm totally reframing what you're thinking, Marcy, but I wanted to make sure we captured your thoughts.
No, that sounds great. Yeah, at the front end.
Anybody else that you think of in your community that, especially those communities in action groups that, hey, they, I really wish they would show up. How do we get them to show up? What do, because there's such a critical piece of moving this forward that we're missing.
Melissa, I think Brett has his hand up, and there also are a number of comments in the chat, ideas about additional partners to include in the process, like colleges and universities, school districts, Head Start, quite a list.
Okay, and then I will answer Jennifer's question after Brett gets to make his comment.
So yesterday was a pretty busy day, and just as you guys are talking, it's like, yes, check, check, check. I did that. So I called the zoning, Hayes City zoning yesterday, touched base with them. I got a call immediately as soon as I said childcare, which is awesome. That used to not happen. I called our fire department. So the deputy chief called. He's coming out to do a just look through kind of a sample floor plan with us. The local technical college is interested in partnering with us to do some food preparations. We had the local college to actually get some training possibilities, and possibly even the school district. So everything you guys are saying, I'm like, whoa, this is awesome. But this all happened yesterday. And that is like, I'm in a different place just because I hear you guys monthly, and having just that experience in childcare, putting it all together. But if I didn't know this, guys, I was done. The first time I heard anybody say, hey, we should maybe look at doing this, I would have walked out. No way. Because it's just so cumbersome. But to have all of these things, I mean, yeah, it's everything you guys are saying is exactly what needs to happen in these communities. So I just wanted to reiterate that.
Well, thank you, Brett. So basically what we have to do, the Go team is like a smaller version of the expertise that's in this work group in CIT is really, I don't want to put words in your mouth, but that's just what I kind of assessed real quickly. Jennifer, you had a question, what the Communities in Action. The Communities in Action is an initiative with Childcare Aware of really meeting the communities where they're at. There was some funding available for them to come together and really assess what they want to do with their childcare needs in their community. And I just reviewed one of the reports a few weeks ago. So I'm just really echoing what Reva stated, that every community was just drastically different. Everybody sort of came to the table and had different initiatives and ideas of what they felt like their community needed. And it was just it's a planning process. And then the Go team hopefully would be a structure that can move some of that and continue to support communities to move that concept into action. So that hopefully answers your question. And I'm just seeing if there was something else that I missed. Okay.
Yeah, Melissa, I think Jennifer might have been asking which communities are Communities in Action. And maybe he could either put that in the chat or, I don't know, send
I think
those out.
Kelly can send me the list, or somebody could put it in the chat. That's great. Sorry,
Okay.
I just meant which communities. Sorry,
Okay.
Melissa.
Okay. No, we can definitely add that as part of our meeting notes. So if you're working in a community that has that, you should be aware of it. Our county, because some of them, I'm looking at Tina and Kristen, and theirs met as multi-county effort. So Southeast Kansas really is approaching it as more of a regional, which is a different concept than some other parts of the state. So always keeping that in mind when you're crossing county areas. Megan, if we can put the next question in there. Is what should coverage look like to support statewide anytime access? So if you wanted to move your community to the next level, what would you expect from this statewide group? Would you expect them to be there tomorrow? What would you want coverage to look like? Is it Zoom? Is it in person? Is it just a nice little handbook that you can reference? What would that look like for you? What would be helpful to your communities?
Do the Communities in Action know that there's a Go team available?
The Go team is just a concept right now that we're trying to put some real meat around so that we can have that be the next level, Kristen.
Okay.
But for
trying
your
to figure out how to phrase that. Because like
Yeah,
if they
but for-
already know about it, to reach out, but are we working
Nope.
on how to get it into their hands?
Yeah,
Or
what would that look like to you? Is somebody who's worked in a community with one of those communities in action? What would you expect from a Go team to help you move forward your initiatives that you guys have laid out?
help in the most simple form. Something quick, but not super quick, if that makes any sense, because we can't expect anybody to be there within 24 hours. But even just a quick email would be handy, or a group of people that could actually meet in person. I know Zoom is handy, but I'm really missing the in-person meetings that we used to have pre-pandemic. So something like that.
Thank you. And then Lisa just echoed that, some of the in-person handbook, emails, visitation, having real tangible tools to move your community to the next level. And access, I'm hoping that it's not necessarily, we don't know who would fund this, but my goal would be, our wish list is not to be driven just by a grant, that it's something that's sustainable in Kansas with some experts that you can always tap into. Bernie, you came off mute.
Yeah, I was just going to add to that, and really it's kind of piggybacking, but I think that the options need to be flexible. Because, like we've mentioned with kind of other pieces of this, what works in Manhattan doesn't work in Hayes, doesn't work in, it's just going to really vary by community needs. And maybe, a way to quickly initiate a conversation that can help identify those needs and then going forward from there, I think would be really useful, rather than trying to develop kind of a one size fits all approach.
Yeah, you work with so many rural communities that one size does not fit all, and we need to be able to meet when they meet, and being able to provide that flexibility. And Nicole piggybacked on that. And digital resource is a must. In-persons are great, but sometimes when we want that expert from another part of the state, you have to be able to virtually connect to make it timely. Oh, a menu. I hadn't thought about it. I really do like that word, a menu. Could be that we're getting closer to lunch, Riva, and I'm just hungry, but a menu would be like, oh, I'm going to send in my menu to the Go team, and this is my order, and can you have it in an hour for me? So I like that idea. So if we want to put in the last, or the question number 6, where does the first step start, and how do we prevent top down? So Riva, this really goes back to what you said just about 10 minutes ago, starting where the community wants to. Because we can come in and we can do an assessment and we can say, hey, this is what we think. But that's, if you don't have the buy-in by the community of where they want to start, then you've lost that community already before we've even began. So how do we assure that, how do we prevent that top-down approach? Any suggestions that have been very invaluable in the communities that you might provide technical assistance to? Anybody? Bernie, how do you ensure that when you're working with your rural communities, that you're not pushing an initiative or a theory that is not where they want to start?
I think, which I'm, stepped away from that work at this point, but, when we were really trying to reach out to rural communities, I think the most important thing was listening. And just being willing to listen and let go of those kind of preconceived ideas that you have. And, once you hear what the needs are, it's a lot easier to figure out how to interact with the tools available, I guess.
Thank you. Kelly, you have your hand up.
Thanks. Yeah, I agree with Bernie's comments. Listening is really important. And I know our team talks a lot about, meeting communities where they're at, but that has to translate into like authentic partnership and actually define the approach and how we even start the conversations with communities. So it's something that we really kind of embed in every step of the process as we're working with them, and really coming alongside and partnering and allowing communities to really determine all of the ingredients that go into their childcare conversation, as far as who's at the table, what their local solution looks like, how fast they want to make progress, or how slow they need to go in order to later speed up. We don't try to really impose any of our own sort of preconceived ideas of what success looks like on a community, but really come in as a supportive partner, and have that be just integrated throughout the entire approach. And I know that sounds kind of conceptual, but it is something I think that can be actually translated into the design of the approach, and can really inform, how a Go team is structured and how the support is provided. And so maybe I'll stop there.
Thanks, Kelly. Lynette, you have your hand up.
I've worked with a couple of different communities that I was able to bring them into a childcare center that I was running to show them what a center looked like. They may have had the numbers that they really wanted to have a childcare center. Loved the concept, loved seeing it. Then took them across town to where we have some homes being built to use as home or group daycares. So took them to the two different facilities to show them the different options. Talk to them about the process, about the different regulations, different requirements, that type of thing. Some communities, by the time they realized the intricacy of a center, were too overwhelmed, and really thought they could start with a group daycare and build on from there. But I agree, listening to them, but having the correct partners at the table. One of them, whether it be I've had some colleges visit, school districts visit, but to have the actual right players there to hear the conversation and to be able to ask questions is important. I do think an additional comment to this is the support after they've made that decision to whether they go to a home daycare, a group daycare, or a center. Just to have that a person to say, I'm trying to fill out this form and I don't know what I'm supposed to put here, here, and here. Can you just look at it and tell me if I'm doing it right? Having a mentor that they could maybe be partnered with, somebody who has been through the process like Brett has been through the process, would be immensely helpful. And as maybe he's going through this process, making a checklist of everything he's done, who he's contacted, just to kind of give them a ballpark of what they should do. Because, there has been a group even in Graham County who's looked at a facility thinking it would work. And then by the time they got in there, realized that they'd be better off building a whole new structure versus trying to renovate an old one. But each group is totally different. There's no cookie cutter approach to any community, just because of who's at the table.
Perfect. Thank you, Lynette. And Megan, I'm going to skip question number 7 and make that last and move into the community lens, because I want to make sure we have time to get these and then go back to that last one. But if there's what we're really wanting to garner next from your group is through the CCSIT is, like, we started this conversation with, there was a talk about a crisis and what that crisis may be. But what are communities using to define the crisis in order to inform potential solutions that fit the unique community needs? So, and we're really challenging that, because we throw down that term a lot, crisis, but we've not quantify what that looks like in each community. Because one of the things that when I first came to even the sitting in as a community member at the Alice County Task Force was to look at how many licensed facilities we have now versus pre-pandemic. And we don't have that many, we don't have a huge change. And we didn't have, and then if you look at the new census data, we barely grew. We were lucky to just stay where we were. So what is driving this conversation that we need all of these new spots? Is it because providers are now self-regulating a little bit more and they're not taking their full capacity? But it hasn't changed too much. So I keep challenging that in my mind when I come to the table of the data doesn't speak to that we've lost 30 homes. So if we did, that would be a huge crisis, but we've not. We've really stayed really on the same track. So I'm really struggling to understand that. So when you guys are coming to the table as groups, what are you using as the data to drive that, to be able to say what the crisis is? Because we don't want to be alarmists in every community. We really want to dig down to what is going on to the community level. So our Go Team group is curious is what's driving. Are you using real data to drive the work that you're doing in your communities?
So I know Childcare Aware, it has great data anyway, and I think is working always, to refine that data. But in our community, it's been a lot, when I'm talking to our childcare task force here, it really is at this point anecdotal, because the data takes a while to catch up, right? Because we've only had one specific program closed down in COVID in Manhattan, but we have to talk about my program in particular is operating at less than 50% capacity. So it's not licensed spots that are the problem, it's the workforce required to fill the licensed slots. And so once we kind of get to a point where we're capturing that data, I think it's going to be easier to show the numbers. But until then, I think, those of us in communities that are experiencing those types of things need to just keep talking about it. And maybe that means, reaching out. And I know that programs often don't do a great job updating like their open slots. And the data has never, and I know Reva's probably going to say some really great things, so I'll kind of let her say it. But, the way that the data is captured was built for a system where slots versus, filled slots versus licensed slots looked very different than it does now. And the reasons for slots being filled looked very different than it doesn't now. So I think it's just going to take a while for those numbers to catch up.
Well, and then I would throw that back to you, Bernie. Would that be something that you would be very interested in with the Go Team helping conceptualize that of what are we missing? Because you're right, because in Hayes, we don't have very many centers. It's mostly home slots. So are they self-regulating, are they saying self-limiting? I'm only going to take 4 kids because that's all I can really handle right now. Because I'm really worried about my own physical and mental health right now. So we just don't have the tools out there to create what we need. And just really hit me that the Go Team could be a really good driver behind that of what is a simple survey that we can assess of really what's going on, because we don't need a 100-question survey. You really need something very simple to assess a community that can be used across the board and then shared with anybody higher up in leadership who's really trying to create what's going on. Riva, and then Kristen.
Just to piggyback on this conversation, I think we've got really great data. I think the issue is that the childcare that is needed by families doesn't necessarily align with the childcare capacity out there. Mm-hmm. And I would say most in particular would be infant care. I cannot tell you how many times a week here at the Parent Resource Center, we get calls from parents that say, I'm off on maternity leave and I'm not going to be able to go back to my job because I can't find childcare. So data is important, and we've got really great data already, but I think it's not always about slots. It's about the ages of the children needing care and the hours that they need care. And that's, I think, the other thing that we've seen is as some programs have reduced their group size, and in some communities where there is a lack of childcare, providers are limiting their hours of operation because they can fill those spots and only work 4 days a week. And that's not going to meet the needs of many working families out there. And again, I think this is going to look very different in every community. And so part of this, the beauty of this community approach is if a community, has manufacturers that need care until midnight, let's tackle that in that community. It doesn't mean every community needs that. And so this customized approach that joins the data that we have and that we can access with that anecdotal piece that we hear, from employers, I can't hire because I need care after 6 p.m. and there isn't any. Then we can develop, by working together, that customized approach to meet that need that was identified in that community.
Kristen.
Basically that, plus I think take myself out of my title now. So just put me as a community member. If somebody called me and was like, oh my gosh, I just tried to put my kid on the list at the center and their number 150. Well, then that sends the whole community in a spiral. Oh, go crisis mode, where really that's not the crisis. That's just one facility. There's plenty of other facilities. You just have to go look for them. So somehow kind of to address that is getting the community in with this so that we're all on the same page.
And that we're driven by data and real needs and not this perceived crisis. Every time you see an article on a national level, it is definitely crisis, when some of it can be just miscommunication within your community.
Yeah.
Brett.
Yes.
I think there's a large part of it also that people want choices and they're more aware of childcare now after COVID. And that lack of choices is creating more of a crisis also, if that makes sense.
Yes, I would agree. Heather?
Well, I think part of it also comes with quality because, like Kristen, we have spots, but parents go out and look and they're like, I'm not doing that. So I think we also need to focus on some of the providers that we already have, helping them provide a more quality, better quality, so that they can get some of those other parents that are just not interested in that.
Right. Why do you have so many openings? And then how do we engage that provider so that they're full eventually and they have that support to have a quality program? Because licensing is just minimal standards. Licensing is not reflective. Even if you come out with a clean survey, does not mean that you're providing quality. It just means you're checking the boxes. So that's something to always keep in mind. Again, it's just minimal standards. The last question that I wanted to hit, because this is a really good conversation, but I really want to make sure I get through the next one on the community lens, because you guys have hit on so many of them. What community challenges could Go Team help address beyond childcare capacity? So we talked about workforce, we talked about affordability, and you guys already hit it, quality and family goals. Is there anything else that we're missing? So very timely, Heather, when you just said quality. Right. And then the very last question, what blocks a community from moving to action? What can we reach out to, or who can we reach out to at the community level? Who is positioned? What keeps a community in that mode of talk, but we're never going to do? So how do we help communities get past that? Make yourself as available. Adrian, what is going to move your community? Because you guys just had your communities in action. What's going to move your community from the talk phase to the action phase?
Well, we have some strong people at the table. We have one of our council members who's also our vice mayor that is very much in favor of our program and what we do and understands the need for it and the economic impact. She's also the one pushing to get our city ordinance changed so it's not a barrier for our providers here in Wichita. So, you know, it's a no judgment zone. Everything gets thrown out and we figure out the best way to put it in action. And Tanya Bullock with Early Childhood Connections has been a great leader on our community and actions meetings that we've had.
So you just said something really important. It's a non-judgmental zone. So you're just throwing out every idea. So that's great. And they should all be entertained. No idea should be crazy. Everything should be laid on the table and assess the craziness later. But in that nugget could be just one small piece. So I appreciate that. And Adrian, is that Becky Tuttle? Yeah. Tell Becky Tuttle sometime I said hi many moons ago. I used to work with her and she's a mover and a shaker. So you guys are lucky to have got her. You have her ear now.
Yes, she's my new BFF.
She will be. She's amazing. Okay, so in honor of time, we have just a few more minutes left. I want to, if there's anything else within that last question of what blocks a community, if you think about that later and you didn't really want to feel like you could share here, or it just hit you later of like, this is really what's happening. And this is really keeping our community I'm working with, our community I'm engaged in to move forward, let me know. And Mitch, I see your hands up. So what do you have to share? Mitch, are you on mute? Can anybody else hear Mitch? Nope.
How about now?
Yeah, perfect.
Success.
Like we're in a Verizon commercial. Ever since we started Zoom, feel like we live in this non-stop Verizon commercial. Can you hear me now? So.
Sorry about that. And I've been asking that question for other reasons. I've been out with congestion. So question, I never heard funding being named as a barrier. So is that's something that I guess I just think about in my work all the time is how are we going to secure the funding to do all this? But I guess from those in the communities, is that not a barrier, or is that just kind of was that so obvious that it didn't need to be said?
I have it on my list. I was waiting for somebody else to bring it up. So yes, funding, and I see several smiles and heading and nods. So I think it is, but it's maybe that overarching barrier that no one wants to talk about. But it really is. And anybody want to share their thoughts on what Mitch just shared?
I'll start. I would say if there wasn't funding, the conversation probably wouldn't even have started. So I think that possible funding, the carrot sitting out there is what is starting the conversations. Now acquiring that funding is the different story, but I think there is funds available. It's just the process of getting to those funds.
So, okay, I appreciate that. And then we will definitely capture that and And really, this goes into the question I did not ask on when we were just talking about the Go team concept, because this is pretty theoretical still as we're trying to flesh it out. And really wondering if we did have this concept, where does it live? What agency does it live within? An agency? Who owns this? And what funds could support this concept? Not asking you to answer the fund concept, but who would be the natural entity to own the work of the Go team, to be the person that moves that forward when that community calls and says, hey, I'm going to send out the bat signal, and we'll have this one for, early childhood, and my community needs help. And you may not have that answer right now. So if you do think about it, please feel free to email it to me, myself or Megan, but really want you to start thinking about that. Kelly, someone said CCA, just one more initiative to add to your program.
Does it have to have one owner, or could it be like this, where we all have different entities, but we're all doing it for the right reasons? So like, does it have to have one house if it's a whole community making it work?
It does. There's no wrong answer here, Kristen. I really like your approach. It could be, when you look at the governance, it could be something that's a sitting board of experts who, when a community has a question, can get together, or reviews supports within, once every 2 weeks, and triages them and figures out who do you connect them with and what does that look like. So that is not a crazy concept at all.
It just kind of reminds me of what the healthcare consultants are for us, like as a surveyor, but the Go team is more for the community, if I'm understanding it correctly. So, I mean, I think, yes, the childcare aware houses all of that healthcare consultant stuff, but they get them connected to the right people at the right time, if that makes any sense.
It does. And I think on that concept, I'm going to just end for the day, because we went through all of the questions, and I appreciate all of the feedback. And if there's something that you're like, wish I would have shared this during the meeting, please feel free to reach back out. But I really wanted, it's just 2 minutes, give you back 2 minutes of your day to stretch before you all move on to your next meeting. And we look forward to seeing you in May, which will be our evening meeting, right? And I love that, Riva. It takes a village. It's going back to your original quote of everybody's going to look differently, and it's going to each group is going to be very, very different. But it does take a village, and I really appreciate. This was a really good gate. Left me thinking that we missed some holes, and so I appreciate everybody that shared today. And those that didn't, if you have something burning and you want to share, just feel free to email it. And you guys have a great day, and look forward to seeing you in May.